The shoulder is not what you're led to believe. It's really not a ball and socket joint. Your hip is a ball and socket joint. The shoulder is really, the best analogy is more like a golf ball on a tee, which allows an incredible amount of motion. In fact, no other joint allows more motion than the shoulder. But it comes at the expense of being a system that's not very constrained by the bony architecture. So as you can imagine, a golf ball on a tee, it's very easy for that golf ball to be tipped off the tee. And with the shoulder, something has to keep that golf ball on the tee for the shoulder to function. So we all know the major motors of the shoulder are the big muscles. The deltoid muscle is the major motor, and then you have your pectoralis, or your chest muscle, and then you have your latissimus dorsi, or the upper back muscle. Those are the workhorses of the shoulder. But if those workhorses were to work in and of themselves with this golf ball and tee design, that golf ball would be tipped off the tee. Okay? So what the rotator cuff does, the rotator cuff works in synchronous fashion with those muscle groups to keep the golf ball centered on the tee to work through mechanical advantage. Rotator cuff problems affect many people at different ages in their life, and treatment will vary depending on when it affects them and to what degree they're affected. So our young athletes a lot of times will just give them a period of rest and then work on the strengthening program. To our middle-aged patients, where similarly we'll treat them with rest and then some medications to help control symptoms, and then a rehabilitative program to try and strengthen up the rest of the shoulder muscles. And even our older adults who can go on to have a full rotator cuff tear, we'll frequently treat them in the same fashion, but sometimes they don't do as well. And then surgical intervention may be warranted to fix a rotator cuff if it continues to cause symptoms in patients despite going through a rehabilitative program.